Caregivers Insight is one of those things where I feel like if we're remotely successful, we are going to make an impact on people's lives in ways that are going to be so profound.
Welcome to Stoakes Health. I'm so glad to spend some one-on-one time. Cool. Really, my goal is twofold. One is just to welcome you formally and spend a little bit of time just getting to know you. And the second thing is we want the world to know about your innovation and be excited about the extraordinary work you're doing. So that was really my objective. And just tell me a little bit more about you and yourself. You're originally from Michigan?
No, I'm originally from Fresno. My parents are Bears. My dad grew up on Bancroft, not too far from the campus near Berkeley High, actually. Yeah, so I'm originally from Fresno, got married during one of my startups, and then moved to Michigan because my wife thought it'd be a good idea that we lived in the same state at the very minimum. And so then I moved out there, and then 9 winters later, at the first moment to move back to warmer climate, I jumped at it, and she jumped in the moving truck, and we've been out in California now for about 3 years.
And you're a serial entrepreneur. What's a little bit about you and your background?
Yeah, I've been in startups from the original .com boom and bust. So I've seen that, how, I don't want to say wasteful, but how free flowing everything was back then. And even before that, out of college, I had a corporate job, but I had ideas of doing something different, and bumped into being an entrepreneur, just seeing how things worked and thinking there's got to be a better way. There's got to be a more efficient way to do this. We got to solve this problem or that problem. And then it just kept on going. And
always in health and healthcare, or?
I did one that was focused in healthcare, working for more of the providers. And that was a very fun, intense process. But no, they've been for various different reasons. This is probably the greatest impact, most impactful venture, to the extent that my father was a pediatric cardiologist, so I could see how helping people and as a pediatric cardiologist, I said, these kids are so innocent. They don't know anything, yet they need so much help. And I'm happy to help them and be in a position to be able to help those survive congenital heart disease. Caregivers Insight is one of those things where I feel like if we're remotely successful, we are going to make an impact on people's lives in ways that are going to be so profound that it'll be a way for me to, I don't know, it's crazy, but not measuring up to my father, but doing something in a similar vein of really helping out people that are in the greatest of needs.
Tell me about Caregivers Insight and really how you describe the mission, the purpose. Obviously, I know about it and I understand what I think it is, but I always love to hear in the founder's words. I know some of the backstory, and I just think it's such an important mission you're focused on. How do you describe the mission and also what you're building and what the solution really is?
Sure. So I was a caregiver for my father remotely from Michigan, 2,500 miles away. And caring for him is very difficult. Even if you're in the same home, it's difficult. It's infinitely, or an order of magnitude, even more difficult when you're 2,500 miles away. We had caregivers that looked after my father who had Alzheimer's. They documented everything, and they would email me the forms or summaries that they had. And the seminal moment was his 4th hospitalization due to dehydration in less than 2 years. That is completely and should be preventable. And I asked one of the caregivers, who's one of the co-founders, I wish he was here with us, but he said, Thomas, we've got to find a different way to do this because the forms are incomplete and I don't read all of them. And we should have caught this. He goes, yeah, it should have been. And I said, I'm going to create something that I think might work. And it was a simple form that asked questions. You just had to answer them, click on a button.
And then we would, like a checklist, basically.
Some of it was a checklist, but some of it was what the doctor had ordered. We've got to start tracking this. His fatigue, we're increasing his medications, we're doing certain things, and I want to see how he's doing. I want to know how his cognition is. I'd like to see how There were probably about 7 or 8 different things that we had to track. And I said, I'm just going to create something and it'll graph it. We'll figure out a way to graph it and see how it's trending. And then I showed it to Thomas, and Thomas goes, I know exactly what you're doing, because he ran a care facility. He goes, I know exactly what you're doing, because I'm going to make an improvement on that. And so we created this really basic form that we could start seeing and share. Everyone could see what was happening, and no one had to send me emails. It was just, I just open up our application, and then I could see early in the mornings, it's 3 hours ahead, I'd see that my dad didn't have much to drink the night before. And I called one of the caregivers and I'd say, hey, you guys seeing this? And yes, I see that's happening. We're on top of that. So that was really that was it. It was like, how do we give my dad not just the same, let's make sure he he wakes up at 8 and gets dressed and does all the things before he gets to breakfast and do all that. It was that rinse and repeat process that the caregivers did. And I know that my dad was, every day he felt different. Mm. You and I feel different every day, and we change our routines. Maybe we sleep in a little bit longer. Maybe we go out and run a little bit further because we feel better. But if we're feeling that way and we're changing our routines, why is my dad getting the same exact care all the time? And it just didn't make sense. I said, we got to fix this. Let's improve his quality of life. Let's improve what we're doing, and how do we do it? And let's do it starting by, let's see how he's feeling, how he's sleeping. Let's track all of these different 8 or 10 different things. And then let's start changing our routines based on what we're seeing. And let's hopefully reduce hospitalizations and doctor visits that are totally avoidable if everyone could see these gradual changes in his care or how he was feeling in his health. It could be mental.
You really created this out of your own personal experience and necessity to manage co-manage with the caregivers for your own father. That's the genesis of everything you're doing now?
Yes, that was it. Thank you for shortening that up. That was a great Cliff's Note summary. Yes.
No, it's I think the one extraordinary thing about what you're doing is, I think this is universal, whether it's for Alzheimer's or many other reasons people are caring for, whether it's a family member, a parent, a child. There's this whole, I think you call it a circle of care. I read. Tell me a little bit about how you think of who this solution's for and who's in that circle of care and all the different players that are now, seems like you're helping coordinate into this one CAREgivers Insight solution.
Yeah, it's helping coordinate and implement the care, empowering the caregivers to say a lot more. And we're just taking all the stuff that you're seeing and putting in a format that now you can start taking action, real basic action to reduce hospitalizations and doctor visits. But who does it benefit? I hate at the expense of saying we're all things to everyone. The benefits of what is recorded and what you can see can benefit everyone in the entire circle of care. And I talk about the circle of care, the caregivers, number one, the care recipients, obviously, family members who want to know what's going on, the caregiver themselves, because the last thing I really dreaded talking to various different family members, my dad's brother, my other sister who lives in Marin, aunts and uncles, like, how's your dad doing? And I'm telling everyone the same story 5 or 6 times. And it's stressful. And then it goes on. And if they could just have access to see what was going on, that we could share that, look at what he's doing, he's having a good day, this is a good time to call him. Should we call him? Should we go out? Should we have lunch with them? And I'd say, today's not a good day. But if they had access to the app, they could say, gosh, Ken's feeling great. He's up and he's out and about. Maybe we should come over. Maybe we should just grab him to have lunch or something like that. They could do that more spontaneous, would make such a big difference in his life. It would have made a difference in all the caregivers, because, like, you're going out to lunch with them, they're going to go do whatever they want to do and take a break. So at the immediate care, it's them, the provider. His doctor was fantastic. And he said, this is any changes in his care plan. Would you like to know what's going on? And we're like, here, we're just going to send you this information. And we'd send it to him like, something's going wrong. Should we be concerned about it? I see it. That's normal. don't worry about it. It's going to persist for a few weeks. If it gets higher than this number, give me a call, but that's pretty normal. So you think about from the provider standpoint, he didn't have to come see him, or we didn't have to bring my dad to see him, which as you grow older with Alzheimer's, a doctor's visit could take him out for a day or two just to recuperate from that. From the payer side, fewer hospitalizations, fewer, all of that. The benefits of being able to see problems sooner, take action is really that little snowball, that little pebble off a mountain that just grows into a snowball in terms of benefits.
How do you really think about on the business side then? Do you as the family member go get this app, or does the provider have it or the insurer have it and then they give it to the whole circle of care? How are you thinking about the different entry points or where you're going to start maybe?
Yeah, that's the 64 or $120 million question we're trying to solve right now, is where does it fit? So right now we have a pilot with a cancer services in Midland, a support group, and that provides non-medical support, gas cards, food, pays for rent, stuff like that. And we're seeing that right now with caregivers, it benefits them and they would recommend it to other caregivers. So we know it works and people use it. The next level is, where in that spectrum of care do they see value and how they can implement it? I think within inside the four walls of a clinic is really difficult because they already have enough on their plate. But maybe is it somewhere out? Is it the payer? Because I've learned that payers have quality and they've got their own care management team, and could it help them? I'm very interested in seeing where that might have does it have legs? Really, I guess the answer is we're trying to find that product market fit.
Yeah. No, that makes sense. And I've seen in different areas, there's different avenues in. You can go direct to consumers, or the patient or the family, or you can go through the system, sometimes both. And I wasn't sure if the plan, as you model these pilots, is you white label this or if it's under one brand. I'm sure you'll test everything along the way to get to the answer. If you could wave a magic wand and over the next year, say, are you looking for more pilots? What kind of is a real win for you? Who are you trying to reach? And that'll help us think about our audience as well a little bit.
Yeah. And you've nailed it. We are looking for more pilots. We're looking for more institutional pilots. Is it a provider? I wouldn't necessarily say residential care facilities are a huge target market for us, because I think the independent caregiver is they represent 89.9% of all caregivers in the marketplace. The other 10 point whatever percent are residential care and your care agencies. So we're trying to hit that huge pie of the independent caregivers. And we think that the providers or your care navigators, your social workers, your community care health workers, that might be an avenue. But we're looking for more pilots. My magic wand, yeah, it'd be great to work with the providers saying, hey, we've got these chronic illnesses that, we're trying to manage better. If we can use your app, we'd like to see how that can create value. That's what I'm leaning towards, because that's where we're getting some interest, where you've got these complex chronic illnesses and you've got these companies that are carving out of the care plans and saying, we can manage these more effectively than your traditional roles of the providers. And so we're high touch, high value, and we're going to manage them better than you can. That would be an area of interest for us to prove that they provide all these different support. They've got a medical staff, they've got nursing, they've got all the bells and whistles they have, but they don't have anything for the caregiver. And they don't have a way to get that information. It bridges the gaps of time between
it's
nurse
such
visits.
an important need for the future as our whole society ages, as the need for caregiving as a category just becomes more and more significant. We're just grateful that you're really a founding member. You fit, I think, into multiple of our moonshots because of the solution will really cross over, I think, whether it's Alzheimer's or cancer. I think it's just really an important solution here. And we're creating this caregiver moonshot.
Yeah.
To really I think there's a whole category of need, and you're really, at the helm here, leading what I think over the coming decades is going to be just, I guess the need is so profound. How do you think about maybe take us out a few years into the future, and as we frame things around health moonshot vision and big dreams, big thinking, how do you think about the solution? What has happened because of your solution? What have we solved as you and your partner really in your wildest dreams? What have you achieved because of what you're building with Caregiver Insights?
Oh, wow. I will try to be as brief as I can, but I think in a couple of years, I think you're going to get a healthier, a more vibrant, aging community that with those that use caregivers are going to be, it's the quality of life for everyone involved is going to be elevated. The stress on a caregiver is going to be so much less because they are more empowered, they're more educated, and they can do things to help that person you're caring for. So for them, they'll feel elevated in terms of their self-worth. And because right now, I think caregivers have so much stress. They're dealing with so many different issues. So I think if they feel better about the person I'm caring for, the family member, they're healthy, they're doing great. The emergencies are going to happen, and those is what they are. They are emergencies. But for the basic things that they're less stressed about, that didn't happen on my watch. That's the scary one. My sister, I'm fearful that something's going to happen on my watch and I'm going to get the blame. That alone for the caregiver is huge. If we are doing what we're doing properly, then the quality of life for the care recipients can be better because they're not going to be going to the doctor or a hospital and stuff like that. Then I think overall, from a global macro standpoint, the stress on our system of healthcare, because seniors consume a disproportionate amount of services and support and utilization, is going to go down. And now the people who are truly in the emergency situation are truly being treated, and it's going to be less stress on them. And there's going to be savings all around from an economic standpoint.
It's really important what you're doing. What do you wish that more people understood about caregivers and caregiving?
Oh, they know so much more. They know you absorb so much more about the person you're caring for. For me, it was my father. I knew instantly what was going on as soon as I could see it. A little bit of dehydration, you just knew it. I could tell.
Even from afar, you like from Zoom or when you would have a conversation, you could just pick up on these signals.
Yes. And everyone had those signals, but they're so focused on make sure he's clean, he's rested, that he's not sick. We as caregivers, first thing I wanted to make sure is like he didn't get sick and he didn't fall, that he ate, that he took his medications. But we knew so much. We all caregivers have so much more knowledge.
I think I was reading, because you're not just tracking some of the basics, you go really deep. I meant over 60 different things you're really understanding more holistically. Can you explain just a little bit about that? I think there's like mental health, you're looking at behavioral, physical.
Yeah, that's a perfect lead question. Yeah, it's 68 different issues and insights that you can personalize. And it's most people think, oh, it's your vitals. What's your blood pressure? What's your O2 sat? And did you eat? And did you drink? And did you get bathing? That's part of the care. But there's the physical care. What's their balance? What's their speech? What's their swallowing? Things that you can't measure. And yet you as a caregiver do know if there are problems with their speech, which for Alzheimer's, that means if their speech isn't very good, they're not using their tongue, which means that could be swallowing. what's their swallowing of food, what's their cognition, all those things that you can measure. So it's that, what about their mental health? That is so important too. Are they agitated? Are they confused? What kind of sleep are they getting? Because that impacts them. Confusion. And then you've got your care. What's your care environment? I was talking to a caregiver and she said, yeah, I wrote a note for someone to make sure that her client had a shower. And she comes back 2 days later and that little note's still on the mirror and her client hadn't been bathed. And it's, yeah, those are the to-do lists. So getting back to, we got your physical health, you've got your mental health, you've got what's going on in your care environment. How much are they hungry? Are they thirsty? How much? Those sorts of things. And then you got medications, which is hugely important. What we've learned from our current pilot is that medication adherence, while we think is simple, isn't so easy.
Yeah.
It's not that they're not following it and they liked, that's one of the benefits that they loved about our app is medication adherence. They can track it and they can see where they're missing their medications. So yeah, we cover it's a whole person focus that you can customize.
That's really amazing. Thank you for that. You're a serial entrepreneur. Tell me a little bit about your perspective on collaborating with other founders. We're so grateful that you're joining our Health Moonshot community and a part of a health transformer in startup health. Just share a little bit about your views on the value of collaboration and being with like-minded peers and why that's important to you.
Oh, yeah. I think the community, the startup community, just in general, is so vibrant. And you get them together or you get them collaborating, and the creative juices and flows and ideas are so powerful. It's something that needs to be leveraged, number one. So that's just that alone. And then working with other founders, I don't think, the one thing I see with working with other founders and collaborating is there shouldn't be any barriers. It's how do we do this? It's not what are the things that are constraining us. Those are things that we can work around and we should work through. And, working with like-minded founders, especially in healthcare, is so valuable. It's a support, it's problem solving, it's coming up with new ideas. And there's the what if is such an important question that I think good founding teams keep asking. What if?
It's just so extraordinary that there's health transformers like you and your partner that are focusing on these areas where there's just such a need, and two, the solutions haven't been properly brought out to the world yet. And that's what you're doing. So thank you. I guess last question would be, what did I miss? What else do you want the world to know about you and caregivers? Anything that comes to mind that you just really wish the ecosystem understands about caregivers and also what you all are doing?
I'll have to think about that a little bit more. But I think that what others need to think about in terms of caregivers is the information that you get from our mobile platform is very powerful. And what makes it more powerful, what makes it so powerful is who utilizes it, how do they utilize it? Because from my standpoint as a caregiver, it's very powerful because now I know I'm going to take care of my dad in a certain way today. He's going to do his PT. He's going to go for a walk, or we're going to go out to lunch or do all those things that makes him happy. But from another perspective, if it's a community health or population health person, like what are they doing here collectively? What does that might mean if we have all this information about all these different people who have Alzheimer's in this area of certain things? And what does it mean to a provider? They can all use this information in the way they can leverage to improve care. You're
facilitating
better. You're smarter than I am, but exactly. We're just something that can facilitate better care.
Yeah.
That's what we'll do. Just have this information that's personalized.
I'm just so glad you're building what you're doing. This has been a gap for too long. And I think there's a number of other opportunities within the community where you bundled with what they're doing could be a really good avenue into business opportunities or pilots or the right networks. I think there's others that we've worked with for many years in kind of the tangential, or I don't know if you know the Care Predict team yet, but others where like you networking with them might give you and accelerate a lot of access or opportunities for you. So I'm just really excited to make those connections and have you be a big part of this. And because I see the need, I've seen it with my own family, and like to have this type of solution working for families and caregivers and providers, it's just going to be a game changer.
Yeah.
Yeah.
I would appreciate any help in that way. We think there's something here. People tell us we have something here, but I think with the right partners and collaborators, we can prove out what we have and the value to whoever that stakeholder is in what we're doing.
You're building at such an interesting time in kind of the post ChatGPT AI world. I think solutions that have come and gone before, I think it's a new moment. So I think what you're creating and how you lean in as your background as the serial entrepreneur, I think is going to be a super strength for you in terms of how you build and innovate moving forward. And I think a really critical time where things need to be more effective, efficient in this new moment where apps aren't just apps, they're supercharged by AI.
Yeah.
So I think that I love that insight is right in your name, because you're going to be providing those meaningful insights to families and caregivers and providers. And that's going to be a game changer. Thank you.
Yeah, that's great. And one last comment about, you mentioned ChatGPT and LLM and AI. I think we are at a very interesting time, because talk about supercharging what we have with AI. Oh my goodness. Think about the efficiency at which things can be done would be amazing.
Yeah. The more you design that in your story, I think will be helpful to you for obvious reasons. And I'm sure you're thinking about that.
Awesome. Thanks, Unity. I really appreciate it. All
Talk
right.
soon.
Thanks.
Bye.
Bye now.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.